back to another episode of STEMspired podcast, where we dive deep into the journeys of rising stars and changemakers in STEM. I'm Dr. Mia, and today we're bringing you a powerful conversation with Shayla Riley Dorsey. She's a future doctor of physical therapy who's not only crushing her academic goals, but she's also making waves as a mentor and advocate for holistic health. And Shayla opens up about the realities of applying to PT school, balancing life as a student, and why representation in rehab sciences truly matters. So, whether you're pre PT or navigating a healthcare pathway, or you just need a little motivation to keep you going, this episode will remind you that your journey is valid and that purpose and passion can absolutely coexist. So, grab your headphones, take a deep breath, and get ready to be inspired by Shayla's story. Let's get into it. Thank you so much, Shayla, for agreeing to be a part of the STEMspired podcast.
Yes, of course, of course. It's always a pleasure to be able to just be able to communicate as well as just converse about different subjects, especially within the STEM world.
Absolutely. So, can you give our viewers a brief introduction of yourself, both professional and personally?
Yes, so my name is Shayla Riley Dorsey. I am a native of South Georgia, so a little small town called Naylor, but I think more people, of course, are know more about Valdosta, Georgia. It's about 15, 20 minutes from there. So as far as for my undergraduate degree, I graduated from Augusta University, December 2021, and then now I am in Doctor of Physical Therapy School, and I started May 2023, and Lord is willing, we'll be graduated in August 2026 with that. As far
Yes, we
yeah,
name
so
it and we
we're
claim it.
happy. We're happy for that, definitely.
I'm so happy for you and just keep treading, keep going. I know those doctorate
No,
programs are so hard, but just keep
very
pressing
much
forward.
so. Very much
So
so hard.
so what inspired you to pursue a career in physical therapy? There's so many different avenues and pathways you can take in healthcare, STEM in general. So when did that clarity of physical therapy career hit you?
Yeah, so I had an idea of wanting to be in the healthcare. My father is a pharmacist. I have other family on my father's side that are nurses, psychologists. So I was like, okay, I want to be in the health field, but I didn't want to be cliche and be like, I want to do this because I want to help people. It's like, okay, I can help people in so many other areas besides healthcare. But my mother, she was basically had surgery of some years back now, but she has back surgery. And I was able to go to a couple of her physical therapy sessions, and I was like, okay, this is cool. And then once I saw that, I kind of like Googled YouTube, especially like at that time, YouTube was, more popping than TikTok.
Yeah,
And
right.
so I was just seeing what exactly physical therapy was. At that time, I was Googling, I saw that it was a bachelor's and then it went to a master's and then it was a doctorate. So like the slow progression per se for it to get to the doctorate degree. And then I was like, okay, so I want to be healthcare. Let's look at majors. Okay, what do I want to per se major in? Because I do want to get more education, whether it was associates or bachelor's. So by the time I got in high school, I was like, okay, I know I need a bachelor's in order to go to a doctorate level. So let me do something that's more in the physical therapy realm, which is what made me major in kinesiology, which so happened I was able to have a pre-concentration in physical therapy. So really it wasn't a like, I know I'm gonna do this since I was one or two, because I really want to be a professional singer. I just really wanted to be on the stage like Beyonce. But I come to figure out throughout middle school, high school, especially undergrad, like I love to do entertainment, sing, dance classes, but that's not something per se I wanted to have as a job, even though I know they said it doesn't feel like a job when you love it so much and have a passion for it. But I wanted to also challenge myself in other ways since I knew I wanted to go into more schooling. So that's kind of like the foundation of, okay, let's go into PT, let's see what this is for me. And then, working, progressing to where I am now, white coated as far as pen, and then now on clinical rotations.
Yes, and look how far you've come just from being there and supporting your mom during her back surgery and seeing, those physical therapists go to work. And
Definitely.
I'm glad that at least we share similar backgrounds as in where we
Right.
come from. And it's not really a lot of representation, and it's not a lot of various career paths that we see. So
Right.
it's good for us to be able to convey this to other people that may not have the exposure like we did. So
Right,
I am
exactly.
proud of you.
Thank you, girl. Thank you. Thank you.
Yes. Yeah. So, what does representation in healthcare mean to you as a Black woman who's becoming a physical therapist?
Um, I think I was fortunate and blessed, honored, all of the words that are describing more positive things. Where my father, his oldest sister, so my auntie, of course, she was one of the first on that side to just go off for schooling. And then she went off for nursing. So I knew, basically pretty much coming into this world, okay, I have someone that's in my family that is a woman and that a Black woman who I've seen in the healthcare. And from being able to see that, and then, like I said, my father, like hearing a tidbit of stuff as I was younger, I was like, okay, I have representation, but that's out of my family. And I know I'm blessed to be able to have that. And I have the privilege, but I'm pretty sure other classmates or other students that were going to my major didn't have that. So I made sure in undergrad that I connected not only with people who are going more towards healthcare, whether that was nursing, whether that was physical therapy, PA, doc, everything. I was like, okay, the school I'm going to, Augusta University, has the Medical College of Georgia. So there's going to be a lot of medical people here. Um, and I got that representation as far as students going more into the field. And then as I was graduating and starting graduate school, that's actually when I saw more representation of Black women in PT. I worked at SGMC for a little while after graduating undergrad, going into graduate school. And at that time, there was only one Black physical therapist. And
Mm-hmm.
that's like, okay, that's not to take away from anyone else was there. But like you said, the representation is like, okay, I want to see someone like me, either who's been through the same struggles or still going through the same struggles,
Yeah.
and seeing them be able to do this job that I'm working for or basically trying to pursue as a career. So representation as far as definitely, as we already know, definitely the biggest thing for us to see. But I also personally knew that even out of the physical therapy field, it's only 2% that are Black, and that's Black women, Black men that are physical therapists, especially at the doctorate level. We're not talking about those who've been grandfathered in from bachelor's or master's per se to get up. So I just made sure I took it upon myself to Google and see what was out there beyond my area of South Georgia,
Mm-hmm.
especially even the surrounding states. We got Carolinas, we got Florida, we got Alabama, to see what is open and see how those physical therapists, who of course are Black women, are doing different things. And it just kind of shaped me more into, okay, let me try to go this track or try to go this way in order to progress throughout my PT career.
Yes, and what I gathered from what you were saying is that you built a support system and a career network in order to
Definitely.
learn more and dive deeper into your career path. So I think doing those things is what sets people apart with having
Mhm.
more clarity about their vision. Because when you just willy-nilly don't know what you're doing,
Yeah,
it's very
definitely.
easy to make like careless mistakes or
Yes.
uninformed decisions. So
Definitely the uninformed decisions is something in the manner of, everything that we do, whether it's something that's easier, whether we've already had the skill, it still takes research. And a lot of people think that that research is more so just, oh, I'm Googling something. A lot of times it's you just sitting by somebody. It's you just being in the vicinity and just listening to a lot of stuff. So research isn't just, like I said, you typing or you looking through some books and blowing the dust off. It's literally everything that we're seeing, viewing, feeling, all the senses throughout the day and so forth.
all the senses. Look, that PT sign coming
I
out.
know.
And speaking of your career network and those things we just talked about, so did you have any mentors or role models? I know you talked about you saw some representation where you were. Can you dive more into that? Like who helped make made you believe this path was possible?
So I don't know. I won't say it's a bad thing, but honestly, me being at SGMC, so South Georgia Medical Center, that was like, okay, I know somebody's doing this and I'm working as a rehab tech to be there. So that was, I
Hmm.
would say, like the cherry on top. But when I was in undergrad, it actually wasn't many individuals going towards PT that was like teaching us. A lot of people that taught us had exercise science degrees. It wasn't really more so
Mm-hmm.
per se PTs teaching us. It was like, okay, they're going to be in the graduate level. So I have mentors. His name is Garrett Green. I still like we call him Dr. Green. But Dr. Green, he was a big mentor as far as for someone that was a listening ear as well as helped connect me into organizations at the school, not only as someone that I love to do different things like student affairs, or we were setting up concerts and this and the fourth. But that was my first take of having a mentor that wasn't like going straight towards medical field. He was a business degree in management and communications and this, that, and the fourth. So he really spoke a lot into me. And then we had another lady named Dr. Patrice Jackson. Loved her. Oh my goodness. Um, and she was very much so to everyone, all just everybody at the school. She just spoke into you to make you understand that, hey, you need rest. Hey, this is what you're doing, but you need to have some type of plan. You can have different roads, the different yellow brick roads, or this blue road or green road, but hey, we're going to still get to the destination as long as we keep the faith. And she was very religious, which I loved as well, as being a Christian background, especially missionary Baptist at that. So those were two that I can say I still consider mentors, and I've talked every now and then since being in graduate school with a busy schedule, but they just helped put more into me and speak more life into me where I already felt optimistic, but I just felt like I could do anything, whether it was PT, whether it was at one point I was thinking about law, just anything in the manner. They made sure that, hey, this is what you want to do. All right, make a plan and see how you can go forth with that. So those were two big main pioneers in my life, and still to this life, I still see them on social media, like, oh, there you go. So yeah, that was definitely the mentors, and then of course, like my mom, my grandfather, my community, especially within my immediate family on both my mom and my father's side. Those were, I don't want to say mentors, but just the other support that I really needed to get through not only undergrad, but especially this process now where I've gotten so far in PT school.
Yes, you have gotten very far. Well, you say you're in year three now, right?
Yeah, basically year three. Yeah, most of the PT programs are like a true 3 years. My program is a little accelerated. For me, my personal process has ended up being the actual 3 years. But typically for most students, it's like 2.7. So even within that, it's like, wow, we're going to school year round, which I know you understand that yourself. And we're getting these little bitty breaks. And it's like, okay, I want to see family, but also I just want to sleep too.
That
But
1 week break, they're like, yeah, you get 1 week. I'm
yeah,
like, that ain't enough.
1 week. I'm like, y'all, I'm trying to go this place. I'm trying to go this place. I'm trying to get some sleep. It's not going to all fit in that 1 week.
I'm like, 1 week. It takes me 1 week to get out of the bed after dealing
That
with you
part.
all for a semester.
Exactly.
Oh
Mm-mm.
goodness. But you made it to year three. So now that you've
Mm-hmm.
been on this path for a little minute now, um, how has your understanding of physical therapy changed from when you first started?
Mm. Um, I think overall the same topic of PTs. I knew coming into PT school per se, and where I am now that hey, they always say we are the body specialists. We are the ones who know all of the insertion points, the movements, the nerves, this, that, and the fourth. So I knew like it was gonna be a lot of work and that we were going to be the movement specialists as far as in that manner. And I think that's still something that still comes to this day per se now with me being in school of the two now almost getting close to the 3 years. But one big thing that I say like changed my perception within PT school from beginning to now was realizing how, a lot of times whether you're inpatient, like in the hospital or nursing homes, or whether you're outpatient with patients coming to you, we are sometimes the only person that literally has a conversation with you for a longer period of time. Meaning, so we have a doctor of physical therapy. Of course, we're not a medical doctor, but when you go to the doctor's office, you're maybe spending the 10, 15 minutes with them. But when you come to therapy with us, we are literally seeing you sometimes every day during the week, according to what setting you're in, but at least 2 to 3 times a week and having more than that hour to just figure out your life, figure out the different things with your emotional, your mental. So we are really big on sometimes the first person that hears everything about your story. And then we take that information, of course, and give it to either the nurses in the hospital or other doctors, so forth. And we are big advocates for patients, which of course all healthcare workers, we want to do that already. But I didn't realize at that time of starting PT school how much information and how much of an advocate we are for our patient, like right beginning, no matter what setting you're in. So yeah.
I love that. And right now, we need a whole bunch of advocacy and healthcare
Yes,
for our patients. And
definitely.
that is top priority right now. So the fact that
Mhm.
you are at the forefront of making sure that patients get the healthcare that they deserve and that they need and that they're not overlooked, heavy on the
Yeah,
not
definitely.
overlooked.
Heavy, 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 not on the overlooked, heavy on, that another thing I learned, like with PTs, the movement specialists, sorry, not to tangent, but movement specialists, but we learn so much about what we call red flags, yellow flags. So red flags of, okay, you're saying my shoulder hurts, but hey, there's all these other nerves, there's all these other diagnoses that we have to ask questions for and do other tests, then to be able to say, hey, I think I want to refer you back to your primary care, or you might want to see this. And that's training that we have to get in this doctorate level in order to not only just be like, oh, we're going to treat your pain right here. It's like, no, we're doing the full examination, full eval, and we're trying to figure out truly where the pain is stemming from, then to give you the best referral. Or even, hey, there's certain people that are in certain programs that may need a little help with groceries, with transportation. And we're like, hey, we have a whole book, flip, 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 and be able to give those as well. So I understood that that was something that PTs do in the career field. But being like, especially in my clinical rotations now, I've done many of those. Hey, let me refer you out to this person. Here's the number. You can call them. They can hopefully help you with transportation. Or hey, this is a great person that can help you with nutrition to while you're exercising and rehabbing your body. These are some great things for you to still do with the internal work. So it's definitely I that's probably actually more above the number one. It's definitely advocating for the patient, but even that, just understanding we're going through all of the systems review and this, that, and the fourth to make sure, hey, we're not just treating something that's muscle or a bone. We're getting you to the right people who also can help in this situation. Because as provide healthcare providers, we're all working together as we should be already, but we're definitely wanting to all work together for the betterment of the patient.
Mm, you better say it. So, I was gonna say you really have had such a strong journey, so much support, so much surrounded by so much love. You're
Yes.
ambitious. So during my journey, I had times where I was unsure, and I'm like, man, did I make the right choice? I'm tired of this.
Yeah.
I'm like this hard. So did you have any points where you experienced any doubts, where you questioned if this was your true path, and if so, how did you navigate going through those feelings?
So let me say this the best way because I could really tangent on this one. But so I mentioned earlier that like the typical time frame for this PT degree at the institution I attend, which is University of St. Augustine in St. Augustine, Florida, is typically 2.7 years, 2.6, according to if you're in program for PT, OT, speech. But as for me, like I said, mine has been closer to that 3 years, actually a little bit over, where I had a point of time where there was a lot of things happening with family as far as health wise, and my head was not. I don't want not in these books as far as not trying to learn, but physically not able to be in class and take in what they're giving me and then be able to go home and study.
Mm-hmm.
So basically what
Mm-hmm.
happened was I ended up having to redo a class, which set me behind per se cohorts, which at that time I was like praying. I was like, Lord, if this is not, I need you to, how people be like, I need a sign. And it'd be like he already say something to you, or either somebody be like, it's an actual sign that fall on them. I didn't have any of that. I just kept praying, and my mom gave me some great advice. She was like, well, sometimes when you're praying, God doesn't per se say anything, and that might be your answer. As we know in more layman's terms, when some people be like, well, if they didn't say anything, that's an answer in itself. And that's truly what it was. So I just continue to pray as well as we're doing the work to sustain from that was back in, let's see, fall 2023, early 2024, and now we're in 2025. Thank you, Lord.
Ooh,
But that was a time I don't want to say that I doubted myself, but I was afraid. So
yeah.
I was always like, okay, High school, we good. We got this. We got the A's. We got the B's. Cool. Undergrad, okay, we got the A's. We got the B's. Ooh, this class wasn't good. Okay, let's pipe it back up. Graduate school, I'm like, okay, I've been doing well. I'm hands on, and PT is all about hands on. And I'm getting to test, and I'm not doing the best, and I'm getting to hands on stuff, and I'm doing very well with that. But it wasn't connecting in the manner of, I guess, hands on and being a great test taker, which is a whole another rabbit hole that we can go down, but we're not going to do that
Yeah, yeah,
today.
yeah. Oh
So that
gosh,
was
we
the time
could.
where, yeah, that was the time where I would really say I was afraid. I don't wouldn't say I doubted myself. I know probably some sentences and the way that I am about dark humor could have possibly been taken a different way. I know my mom's mentioned that a couple times, but I just really was fearful. Like, okay, even when I got to a year of like, oh, I had to retake this because I was like, oh my gosh, okay, I've been back, I'm in school and I'm doing good, but oh my gosh, this time last year, this happened. Okay, like trying to use relaxation techniques, of course, and just getting through it. So I wouldn't say any doubts, but definitely saying fear of what has happened, which happens in personal life, and truly me praying, truly me keep doing stuff, me getting into doing dance classes in the area where I do class, like academic classes, and just being like, Shayla, when you were younger, you like you said, ambitious and not fearful. So why are you being fearful and afraid now? And that was definitely more self-talk than anything. Had great friends who are still here with me this day, who helped me, and they have to get onto me because they say I'm hard-headed, which is okay. I get it from both sides of the family. But definitely, doing my best not to be fearful. And thankfully, I didn't have any doubts per se, but just trusting that, hey, this is something that I'm still eager to do. This is something that I'm very well in. And I know I can do so many other things because I just try to immerse myself in so much. But this is something that I want to be a long and have longevity in this career field.
Right. And I can totally understand that. And I think also sometimes it's good to sit in that fear for a few minutes
Yeah. And
to
I needed
ignite
that.
your
Yeah.
fire,
Yeah.
um and I feel like, at least for me, moments of fear is what made me rise like a phoenix and
Yes.
say you know what, I'm gonna tackle this head on, and I know that I can do this. Nothing can stop
Yes.
me. You just have to. It takes the same faith that we put out to God, we have to put it back in ourselves. And
Yes.
so I learned
That's
that a lot.
that definitely that. And then one more tidbit I'll say is definitely just after, having that fearful moment and like you said, sitting in it. I with a lot of different emotions, whether it was family, whether it was health, whether it was academics, I've allowed myself more. I guess I am older now, but I've allowed myself to sit more in it. And I've always, I think, done very well with trying to have like positive outcomes and being positive about certain situations. But there was just times where I know my mom, she was like, okay, your tone a little different. You want to watch that? And I'd be like, no, but just making sure that I kept the faith, like you said, and then kept the work, and then made sure that I did positive self-talk rather than negative connotations and so forth.
Yep, and the messages don't. It's okay to have fear, but you have to learn how to process and still make it happen.
Definitely with that. Definitely with that.
Yeah, so with that, what advice would you give to anyone who may feel behind or discouraged along their journey in STEM?
Ooh, number one, feel those feelings because if you hold it and you keep pushing, it's going to erupt before you want it to erupt. And that's not the case for everyone. That's probably 99.99333% mostly everyone in STEM. But definitely, if you're feeling like, okay, I feel like I'm not worthy enough for this, or I'm just really having a hard time, sit in it for the minute and try to back away from it. Try to pull yourself out of the situation. It's easier said than done, but try to pull yourself out of the situation and go through, I say, your pros and cons. Okay, this is the good that has happened. This is what's going on. This is what I know I can do. This is what I know I can change. Okay, the other end, this is something that
Mm-hmm.
I can't change. And like I said, it's easier said than done because I have moments where I'm like, oh, I wish this could have went this way. And I'm like, wait, Shayla, okay, let's pause for a minute and let's think this out. So I really just say that overall, like feel what you're feeling.
Mm-hmm.
And like I said, I was blessed to have a support system, those my age, older, my family. And so if you can connect with any groups, whether that's within the school, whether that's a specialty you want to do within the healthcare field, or just anything within STEM, or also if you are on a religious manner, you can go to a church home and have that connection. Like, I'm not putting religion or Christianity or on anyone. I definitely know it's helped me, how it's helped me, and all I can do is pretty much share my testimony and try to help furthermore from that.
I know that's right. You say I'm gonna tell you what I've done, but
uh
you decide. Is your discretion.
Yes, and at the end, I would be like, but that's how I would do it, just so you won't be like, oh, you told me. Yeah, but like, that's how I do it. Just lean back
I
and let you
think
go live with
I think your past just highlights the importance of having faith.
it.
I try to be careful with the resilience word because it has some
Yeah,
connotations
yeah, yeah,
sometimes
yeah,
to
yeah.
me. But tenacity, that's the word.
That's a
Tenacity,
good one.
that's a better one.
Tenacity,
That's a better
definitely,
one.
definitely
So I love
tenacity.
that your story conveys how important tenacity is and knowing that life happens. Like
Yeah,
sometimes life just isn't fair. It's not going to go your way
it's not.
sometimes. And
It's
you have
not.
to learn how to pivot and still speak life into yourself regardless.
Right.
I know I like seeing your journey on social media and connecting with you. So how can our audience and the scholars who are watching this connect with you and keep up with your PT journey?
Yeah, so my PT journey is definitely fully exposed, per se public profile on more so on Instagram. I feel like everyone has a Facebook, but that's like I just keep up with that so I can know family and classmates. But as far as Instagram, my name is Angelica Now, so that's ANGE as an elephant, LIQUE as an elephant, and then the word now, NOW. And that's pretty much where I do a lot of modeling as far as pictures, as well as I'm not per se a blogger. I have some people that are in my cohort that more so blog. But you'll just see pop-ins of me doing stuff for the school with PT. I'm also in an organization called Student Veterans of America, as my father is now a veteran in the Army, and I am personally thinking of working with Veterans Affairs and military affiliated patients as a PT. So
Yes.
yeah, I try to pop that in, and then sometimes you just see me dancing, and that has truly been keeping me sane, not only through the classes, but throughout all of the personal factors that happen while you're still trying to get this degree.
Oh, yes, honey. Well, y'all, that's a wrap on this episode of the STEMspired podcast. A huge thank you to Shayla for
No,
sharing
thank
her
you, Mia.
journey, her wisdom, and her truth, y'all. Tell the truth. And
Tell the truth.
from navigating the challenges of PT school to showing up boldly as a Black woman in healthcare, Shayla reminded us all that the path to purpose is rarely linear, but it's always worth it. So if her
Yeah.
story resonated with you, be sure to follow her on social media, her Instagram account that she told y'all. You'll see it in the captions and support her work as she continues to educate, inspire, and empower future healthcare professionals. Don't forget to subscribe, like, and it helps us reach more listeners just like you who are finding their way in STEM. And as always, stay curious, stay committed, and remember you belong in every room your goals takes you to. Until next time, keep rising.